Introduction. Welcome, medical students, to today's lecture on the topic of leukodystrophies. Leukodystrophies are a group of rare genetic disorders that primarily affect the white matter of the brain, leading to various neurological manifestations. In this lecture, we will discuss the classification of leukodystrophies and dive into specific subtypes, including X-linked adrenoleukodystrophy, ALD, metachromatic leukodystrophy, MLD, Krabbe disease, Pelizaeus-Merzbacher disease, PMD, along with various aspects related to clinical evaluation, genetic counseling, management, emerging therapies, clinical trials, psychosocial impact, prognosis, and end-of-life care. So let's begin our journey into the intricate world of leukodystrophies. Leukodystrophies, a group of rare genetic disorders affecting the white matter in the brain, can be classified based on the specific genetic abnormalities involved and the white matter structures affected. Some commonly known subtypes of leukodystrophies include adrenoleukodystrophy, ALD, metachromatic leukodystrophy, MLD, Krabbe disease, Pelizaeus-Merzbacher disease, PMD, and others. By understanding the classification of these disorders, healthcare professionals can better diagnose and manage these conditions, leading to improved patient outcomes. ALD is one of the most prevalent forms of leukodystrophy. It is characterized by a defect in the ABCD1 gene, resulting in impaired peroxisomal beta oxidation. This leads to the accumulation of very long-chain fatty acids, VLCFAs, causing progressive demyelination in the central nervous system. The clinical presentation varies, with symptoms ranging from behavioral changes, adrenal insufficiency, and progressive neurologic decline. Early detection and management of ALD are crucial to prevent severe disability. MLD is an autosomal recessive disorder caused by the deficiency of the enzyme aryl sulfatase A, ARSA, leading to the accumulation of sulfatides. The disease primarily affects the central and peripheral nervous systems, resulting in progressive motor and cognitive deterioration. Different forms of MLD exist, including late infantile, juvenile, and adult onset types. Early diagnosis through genetic testing and neuroimaging is vital for appropriate management and supportive care. Krabbe disease, also known as globoid cell leukodystrophy, is an autosomal recessive disorder caused by mutations in the GALK gene, resulting in impaired breakdown of lipids. The accumulation of toxic substances, such as cycosine, causes destruction of myelin-producing cells. The disease has various forms, including early infantile, late infantile, and adult onset. Early identification through newborn screening and initiation of hematopoietic stem cell transplantation can improve outcomes in affected individuals. PMD is an X-linked recessive disorder caused by mutations in the PLP1 gene, leading to abnormal myelination in the central nervous system. The disease manifests with hypotonia, nystagmus, and progressive spasticity. Phenotypic variability exists, ranging from severe conatal forms to milder forms with slow progression. Genetic counseling and prenatal testing are essential for families with a history of PMD to facilitate informed decision-making. When evaluating patients with leukodystrophies, clinicians conduct a thorough neurological examination to assess their symptoms and determine disease progression. Additionally, the evaluation involves tracking developmental milestones to identify any delays or regressions. To confirm the diagnosis and provide prognostic information, neuroimaging techniques such as magnetic resonance imaging, MRI, and spectroscopy, MISs, are utilized. These imaging modalities play a critical role in visualizing and analyzing the brain's white matter, helping to identify characteristic abnormalities and monitor disease progression over time. Genetic counseling and testing are integral components in the management of leukodystrophies. Genetic counselors play a crucial role in providing families with accurate information about the inheritance patterns, recurrence risks, and available testing options. Genetic testing techniques, such as sequencing of specific genes or whole exome sequencing, aid in confirming the diagnosis, identifying carrier status, and facilitating family planning. In the management of leukodystrophies, our primary goals are centered around alleviating symptoms, maintaining functional abilities, and enhancing the overall quality of life for individuals affected by this condition. To achieve these aims, a multidisciplinary approach is utilized, incorporating various therapeutic modalities such as physiotherapy, occupational therapy, speech therapy, and pharmacological interventions. These interventions are tailored to address specific symptoms commonly associated with leukodystrophies, such as spasticity, seizures, and respiratory complications. By implementing these strategies, healthcare professionals strive to provide comprehensive care and support for patients with leukodystrophies. Research in the field of leukodystrophy has led to exciting discoveries regarding potential emerging therapies. Some of these therapies include gene therapy, enzyme replacement therapy, stem cell-based approaches, and other experimental treatments. While it is important to note that these therapies are still in the early stages of development, they hold promise for improving outcomes and slowing down the progression of the disease in individuals affected by leukodystrophy. Continued research and clinical trials are crucial to further our understanding and optimize the potential of these emerging therapies. Investigational studies and clinical trials play a crucial role in advancing our understanding of leukodystrophies and exploring potential treatment options. By conducting these studies, researchers gather evidence to support the development of effective management strategies for individuals with leukodystrophies. These studies focus on evaluating new interventions and therapies, aiming to provide promising treatment options for affected individuals. Through careful analysis and experimentation, these trials contribute to shaping future approaches in the field of leukodystrophy management. Leukodystrophies not only affect the physical well-being of individuals but also have a profound psychosocial impact on patients and their families. Adequate psychosocial support, palliative care services, and access to support groups are crucial in addressing emotional and psychological needs, facilitating coping strategies, and enhancing the overall quality of life for affected individuals and their caregivers. In leukodystrophies, understanding the prognosis and providing appropriate end-of-life care are crucial aspects of patient management. Healthcare providers should foster open and honest communication with patients and their families, discussing the expected progression of the disease, potential options for palliative care, and the need for advanced care planning. These discussions are essential in ensuring that patients' preferences and comfort are prioritized during the later stages of their illness. Leukodystrophies pose significant challenges in diagnostic accuracy, management, and emotional well-being of affected individuals and their families. By understanding the classification, genetic basis, clinical evaluation, management strategies, emerging therapies, and psychosocial impact, medical practitioners can provide comprehensive care and support for patients with leukodystrophies. Continued research and collaborations are vital in advancing our knowledge and improving the outcomes for individuals affected by these debilitating diseases.